A sudden tingling in your fingers, followed by muscle weakness, could signal something far more serious, Guillain-Barré Syndrome. For many, it starts with weakness in the legs, gradually spreading to the arms and face, turning an ordinary day into a challenging battle. Let's know more about this mysterious syndrome. Number 1. What is Guillain-Barré Syndrome? Guillain-Barré Syndrome, GBS, is a rare, autoimmune disorder in which the immune system mistakenly attacks the peripheral nerves. It leads to muscle weakness, tingling sensations, and in severe cases, paralysis. It often starts in the legs and spreads upward. Number 2. What causes Guillain-Barré Syndrome? Guillain-Barré Syndrome is caused by an abnormal immune response where the body's immune system attacks the peripheral nerves. It is often triggered by infections, such as respiratory illnesses or gastrointestinal infections, commonly caused by Campylobacter jejuni. Other triggers include viral infections, like Zika or influenza, surgery, or, in rare cases, vaccinations. The exact reason why the immune system targets the nerves is not fully understood. Number 3. What are the early symptoms of Guillain-Barré Syndrome? The early symptoms of Guillain-Barré Syndrome typically include tingling or pins and needle sensations in the hands, feet, or face, along with muscle weakness starting in the legs and spreading upward. Other initial signs may include difficulty walking, climbing stairs, and pain in the lower back or limbs. These symptoms usually progress over days to weeks. Number 4. How is Guillain-Barré Syndrome diagnosed? Guillain-Barré Syndrome's diagnosis involves checking for muscle weakness, reflex loss, and other characteristic symptoms. Nerve conduction studies are done to assess the function and electrical activity of peripheral nerves. One other test is lumbar puncture or spinal tap, which is done to test cerebrospinal fluid for elevated protein levels without an increase in white blood cells. These diagnostic tools help distinguish GBS from other neurological disorders. Number 5. Is Guillain-Barré Syndrome contagious? No, GBS is not contagious. It is an autoimmune condition, not an infectious disease. Number 6. How serious is Guillain-Barré Syndrome? Guillain-Barré Syndrome can range from mild to life-threatening. In severe cases, it can cause paralysis, difficulty breathing, and issues with heart rate or blood pressure, requiring intensive care. While most people recover fully, timely treatment is crucial to prevent serious complications. Number 7. How is Guillain-Barré Syndrome treated? Guillain-Barré Syndrome is treated with therapies like intravenous immunoglobulin, IVIG, to block harmful antibodies, or plasma exchange, plasmapheresis, to remove harmful antibodies from the blood. Supportive care, such as pain management, respiratory support, and physical therapy, is also important for recovery. Number 8. How long does it take to recover from Guillain-Barré Syndrome? Recovery from Guillain-Barré Syndrome varies depending on the severity of the condition. Mild cases may recover in a few weeks, while severe cases can take several months to a year or longer. Number 9. Can Guillain-Barré Syndrome cause permanent damage? While most people with Guillain-Barré Syndrome recover fully, some may experience long-term complications such as persistent muscle weakness, numbness, or fatigue. In rare cases, GBS can cause permanent nerve damage, but this is uncommon. Number 10. Is Guillain-Barré Syndrome related to vaccines? In rare cases, Guillain-Barré Syndrome has been linked to certain vaccines, such as the influenza vaccine, but the risk is very low. The benefits of vaccination far outweigh the small risk of developing GBS, especially when considering the protection against serious diseases. Number 11. Can Guillain-Barré Syndrome be prevented? There is no known way to prevent Guillain-Barré Syndrome. However, reducing the risk of infections through good hygiene practices, safe food handling, and vaccination against certain diseases, like influenza, can help lower the chances of developing GBS. Number 12. Can Guillain-Barré Syndrome recur? Recurrence of Guillain-Barré Syndrome is rare, but its reinfection is possible. Most people experience Guillain-Barré Syndrome only once, but in some cases, individuals may develop it again, usually with less severity than the first episode. Number 13. Is there a cure for Guillain-Barré Syndrome? There is no cure for Guillain-Barré Syndrome, but with timely treatment, most people recover fully. Treatment options, such as intravenous immunoglobulin, IVIG, or plasma exchange, can help reduce the severity of symptoms and speed up recovery. Guillain-Barré Syndrome may be rare, but understanding it can help us recognize its signs and seek timely treatment. If you found this video helpful, don't forget to like, share, and subscribe for more valuable insights and updates.